and maintains long-term steroid-free remission in patients who have failed thiopurine monotherapy. We conclude that this therapy is an alternative long-term maintenance strategy for IBD patients failing conventional thiopurine therapy with a preferential thiopurine metabolism towards 6-MMP. Thank you.
Questions? Microphone one, please.
Aaron Brzezinski from Cleveland Clinic. How did you adjust the dose of thiopurines when you introduced thiopurine?
We generally lower the dose of thiopurines to 1/4 of the original dose. We measure the blood counts and the metabolites, and then titrate the dose based on those two parameters.
Two quick questions. So it wasn't clear from your inclusion criteria. Were all these people shunting to 6-MMP?
Almost all of them, except 3 who already had gout and were on allopurinol beforehand.
And what about their TPMT enzyme activity before you added allopurinol? Were they all at normal TPMT?
We measured TPMT enzyme activity in a subgroup of 26 patients. The numbers were quite random. There were even patients with low to intermediate enzyme activity, but still very high 6-MMP levels. So in our hands, TPMT enzyme activity was not predictive.
Nice talk. Do you have an algorithm for deciding when you have a patient failing, when do you just say add an anti-TNF versus use this strategy? Do you have a sort of an algorithm in your mind for how you would do this?
I think patients who fail thiopurine therapy should first have all the attempts to try to optimize therapy using metabolite levels. And in some patients who are maybe shunters, they could benefit from the addition of allopurinol. I think that's step number 1. And if that's been tried and doesn't work, then I think the next step could be anti-TNF therapy.
And then once you've added the allopurinol, what's your clinical recommendation for how often you should be getting CBCs?
Generally, in the first month, I would recommend doing it once every 1 or 2 weeks. Once they're stable, I would recommend doing it every 3 months.
Great.
Every week. First month.
Do you have any other questions? Okay.
Okay. Thank you for joining us. Go on your seats. We have a very important special lecture being presented, and we will hopefully someone's got to introduce it.